Namaste. Let us understand fractures of the nasal septum. Like all other fractures, nasal septal fractures are also caused due to trauma. Trauma can be caused as a road traffic accident, as a punch, as blows, and also due to falls. Due to trauma to the nose, septal injuries can occur. The septum involves the bony septum and the cartilaginous septum. These parts can be affected as smashing, breaking, or twisting. The septal injuries may or may not be associated with mucosal tears. If it is associated with mucosal tears, it can present as profuse epistaxis. And if the mucosa is intact, it can give rise to hematoma. If this septal hematoma is not drained early, it will cause absorption of the septal cartilage and can cause saddle nose deformity. That is how the pathogenesis of the fracture of nasal septum will occur. The septal fracture can be classified into two classes. The class 1 fracture is known as Chevalier fracture, and the class 2 fracture is known as Jargevay fracture. Now let us first label the important parts of the septum. This is the septal cartilage, this is the ethmoid, this is the vomer, and this is the nasal bone. I have explained the septum in one of my videos. If you have any doubt, you can watch it there. Moving back to Chevalier fracture. The cause of Chevalier fracture is a blow from below. Now due to this, the fracture line runs vertically from the anterior nasal spine upwards to the junction of bony and cartilaginous dorsum of the nose. This is the dorsum and this is the anterior nasal spine. In Jargevay fracture, the blow is from the front and the fracture line goes from the anterior nasal spine and then parallel to the vomer and the septal cartilage junction. Now the Chevalier fracture is a vertical fracture, whereas Jargevay fracture is a horizontal fracture. Chevalier results in less severe deformity, and Jargevay shows a severe deformity. Let's move forward. Clinically, any fracture is going to present with pain, bleeding, and can show nasal deformity. Some other features are nasal obstruction, which can also present as difficulty in breathing, swelling and tenderness of the nose. The most important investigation is clinical examination. We inspect the external nose and then we can also do anterior rhinoscopy or endoscopy if required. We assess for septal hematoma or abscess. Then we also examine for other facial injuries. In imaging, we can do X-ray, but X-ray has limited value here now because not all fractures are visible in an X-ray, and undisplaced fractures are rarely going to be visible. Then we can also do CT scan of the nose and paranasal sinuses. Now, this is indicated when facial fractures are suspected. It can show septal fractures, nasal bone fractures, and orbital or maxillary fractures. We can understand the complications by learning it as early complications and as late complications. The early complication can be epistaxis, bleeding, which we have seen earlier, and septal hematoma. We have seen this also earlier. It can lead to septal abscess also, nasal obstructions, infections, etc. In late complications, the important ones are deviated nasal septum, persistent nasal obstruction, saddle nose deformity. Now, why is the septal hematoma important? Septal hematoma is important because the complications of septal hematoma, such as septal abscess, then septal perforation, or saddle nose deformity, or cartilage necrosis. These things can also occur. Therefore, septal hematoma is important. And also, we have to drain this hematoma ASAP. Otherwise, it will block the nasal passage. How are we going to treat this patient? First of all, we have to wait for the edema to subside. We wait for 5 to 7 days. Then we look for deformity. If there is no deformity, we can do symptomatic treatment. But if the deformity is present, we have to go for closed reduction. Now for septum, we use Ash's forceps. This is the Ash's forceps. We use this to refracture the septum, we realign them, and then later it heals in a regular pattern. Whereas you can confuse it with Walsham's forceps. Walsham's forceps is used for nasal bone fracture. Ash's forceps is slightly curved, whereas Walsham's forceps is not curved. We said that we do symptomatic treatment if there is no deformity. We can also say that we do symptomatic treatment for minor non-displaced fractures. And we give analgesics, ice packs, and observe the patient. In surgical treatment, we have done closed reduction. We also do septal realignment. And I have already said that if there is a septal hematoma, we drain it immediately. If the patient presents late, that is more than 3 weeks after the fracture, along with deformity, we can't do closed reduction in that case. So here we do rhinoplasty or septorhinoplasty. Thank you. This is my last video in the nasal septum series. I have completed 4 to 5 topics of this series. You can watch them if you like this, and please subscribe for more such videos. Thank you.